And we will note the roll. Representative Gander moves the minutes from January 16th, 2024. Are there any additions, corrections, or changes? Seeing none, all in favor of approving the minutes signify by saying aye. Aye. Opposed, same sign. The minutes are approved. Today, we have the honored presence of our Office of Legislative Auditor to discuss the December 2024 report on the Department of Human Services, the outstanding provider debt in Minnesota's Medicaid program. And so welcome to the committee, and please introduce yourself for the record and begin with your presentation.
Thank you, Mr. Chair and members. For the record, my name is Judy Randall. I'm the Legislative Auditor, and I want to say thank you for taking the time to hear this report today. As Mr. Chair said, we released this report in December, so just about a month ago. Before I turn it over to Deputy Legislative Auditor Lyson to discuss the specific findings and recommendations, I just want to make a few more general comments. OLA identified these overpayments as an area of concern when our auditors were conducting last year's audit of the state's financial statements. Because the amount in question, between $40 and $50 million, is not material for the state's financial statements, we didn't report on it as part of that financial statement work. Instead, we then launched this additional performance audit to look into it more deeply. We think the findings in this report are very concerning. There are many things concerning in the report, and Ms. Lyson will go over those, but I want to just highlight the three that worry me the most. First of all, DHS did not know about the extent of these overpayments and the outstanding balances until OLA began asking questions and until we initiated this audit. Second, DHS's data are so poor related to this issue that frankly neither DHS nor our auditors could get a really clear understanding of exactly how much money has been overpaid and to which providers. Finally, the third thing that concerns me the most is that DHS plans to forego recovery of overpayments that are in fact recoverable. For example, they are foregoing recovery of any balances less than $1,000. That adds up to some real money. So just highlighting those to especially pay attention to as you hear the rest of our presentation. And with that, Mr. Chair, I'd like to turn it over to Ms. Lyson. Thank you.
All right, welcome to the committee. Ms. Lyson, please introduce yourself for the record and begin your testimony.
Thank you, Mr. Chair and members. For the record, my name is Lori Lyson. I'm the Deputy Legislative Auditor for the Financial Audit Division. And today I'm going to discuss a performance audit that we conducted on the Department of Human Services. It's the outstanding provider debt in Minnesota's Medicaid program, which, as a couple of us have now said, was released back in December, on December 10th. Okay, so the Department of Human Services oversees the Minnesota healthcare programs, which includes medical assistance, Minnesota Care, and the Minnesota Family Planning Program. These programs work with medical providers in healthcare settings such as clinics, hospitals, nursing homes, and other settings. Our audit focuses specifically on those services covered by medical assistance and reimbursed by the Department of Human Services on a fee-for-service basis. So when you look at the screen, it's that bottom left-hand corner that we really audited and focused on. So medical providers, how this happens is medical providers submit claims for reimbursement through the Department of Human Services Medicaid Management Information System. Then the Department of Human Services reimburses that medical provider based on that claim that's submitted. However, after that provider submits the claim, there are times when adjustments need to be made. These adjustments can be made by the provider themselves. It could be identified by the county, or it could be identified by the state. The adjustment itself, just wanted to restate, that is actually made by the state, but can be identified by one of those three entities. Those adjustments can be caused by things like rate changes, audits, or an error that was identified. So These adjustments can cause what we are calling an overpayment to the provider. And when this occurs, the Department of Human Services, as I said, makes that adjustment in MMIS, in that system. Then the system calculates what we're calling that overpayment, and it'll offset any overpayment against any future claims. So this means if the provider is still an active provider, which means they are still submitting claims to the Department of Human Services, those overpayments will reduce on the current claim. So let's just say the state identified $100 in overpayment. Then that medical provider submits a claim for $1,000. The system should then trigger and understand that there is an overpayment, and they'll reduce that claim by $100, and therefore will reimburse only $900 instead of $1,000. However, in this case, if the provider is no longer active, then the Department of Human Services has a policy and procedure on how to recoup any overpayments, which we're going to discuss on the upcoming slide here. So the objectives of our audit were to determine if the Department of Human Services complied with legal requirements that we tested, and if they had adequate internal controls to recover outstanding provider debt and for financial reporting. Our outstanding provider debt, kind of the scope of our audit, ranged back from October of 2006 through June of 2023. We'll bring those dates back again later in a future slide. So in fiscal year 2023, as Auditor Randall mentioned, the Department of Human Services certified to Minnesota Management and Budget that they had a provider debt balance of $51.7 million across approximately 2,500 providers. This balance is included in the accounts receivable balance in the state's financial statements. So during that financial statement work that we conducted, which was in the fall of 2023, we discovered that the Department of Human Service did not appear to be collecting on this balance, and as a result, we then conducted this audit. So our testing really focused on the long-term care facilities, which makes up 62% of this population, and then we also wanted to focus on the 9 largest balances. And of those 9 largest balances, 6 of those are long-term care facilities as well. And those balances for the 9 largest entities range from $1.4 million to $5.4 million. So our conclusion here is that the Department of Human Services did not comply with legal requirements that we tested. They did not have adequate internal controls, and as a result, we have 4 findings. This first finding is that the Department of Human Services has not attempted to recover over $40 million in outstanding overpayments to medical assistant providers. The Department of Human Services has not tried to collect on these outstanding provider debts since it sent a collection notice to 1 provider in 2019, and then a collection of providers in 2015. So we really don't know the extent of how long it's been since they've been actively trying to recover on this outstanding debt. So our recommendations are very simple here. We think they should recover the debt, and we think they should improve internal controls. So there are essentially 2 divisions that are responsible for the provider debt in the Department of Human Services. There's the Healthcare Administration Division, and then there's the Finance Operations Division. I'm just going to call them, for purposes of this presentation, the Program Area and the Finance Division. So there is some criteria that the Department of Human Services has. They have a procedure that states that it's the Program Area's responsibility to identify that debt and then to notify the medical provider. And then the Department of Human Services has a policy that states it's the Finance Division to actually then pursue the recovery of that debt. So the cause here of this finding is that the program area, right, the one that's responsible for identifying and notifying the providers, identifying the amount of outstanding balances and notifying the providers, they were not aware that this was their responsibility. And then the Finance Division, again, they're the ones responsible for the actual recovery of this debt. They stated that since MMIS, right, that system, that Medicaid management system, is not a system that they're familiar with, they're not going to assist with the collection of the outstanding debt. So we essentially kind of have fingers pointing at different entities saying it's not our responsibility, or we weren't aware that it was our responsibility. So then our next finding is that the Department of Human Services is planning to forego recovery of outstanding debt that may still be recoverable. So to address our questions and to resolve the outstanding provider debt, the Department of Human Services really grouped together these balances into 4 main groups. We have balances that are under 1,000, balances that are over 6 years old. We have providers that either filed bankruptcy or are deceased. And then that last grouping is really the Department of Human Services group that they're planning to recover on. This finding really relates to those first 2 bullets of balances under 1,000 and balances over 6 years old. So first, if we look at those balances that are under 1,000, the department has a policy that states that debt that is less than $25 can be written off. For this situation, leadership made a one-time exception and said that due to the administrative burden of collecting, they're going to forego recovery on those balances that are under 1,000. And then if we move over to those balances that are over 6 years old, the Department of Human Services claims there's a 6-year statute of limitations here. However, we disagree that the statute applies to administrative actions. And in both cases, we believe that at the very least, providers should be made aware of the outstanding debt and a notification letter should be sent to these providers. Our recommendations here are that the department should recover debt in accordance with state law and its own policy, and that they should work with the legislature to clarify its authority to recover outstanding debt. So this next finding kind of comes back to the financial reporting where we identified this issue. And so the finding is that the Department of Human Services is not accurately reporting accounts receivable balance to Minnesota Management and Budget for inclusion in the state's financial statement. So the state requires agencies to analyze their AR, their accounts receivable activity annually, and estimate a portion of debt that they do not expect to recoup. The Department of Human Services does this by running a pre-programmed report to identify the receivable balance, and then they use a preset formula to calculate the balance that they do not expect to recoup. The problem here is that the Department of Human Services has not updated or reassessed its calculation to determine that portion of debt that it doesn't expect to recoup from the provider since 2019. So that percentage that they're taking has remained stagnant since 2019. The cause here, and I should say too, and that's despite the fact that that balance has continuously increased since 2016. We took a look back to the balance that they've reported to Minnesota Management and Budget since 2016, and it's continuously grown. So as a result of that, you would think that that collection of trying to recover, they would have increased, and said that they, the further you get away from the time that debt occurs, the less likely it is that you're going to be able to recoup on it. So the cause here is very similar to the cause that we saw in the first finding, that the finance division claims it's the program area's responsibility, and the program area is stating that they were unaware that it was their responsibility. So before certifying this amount to Minnesota Management and Budget, we think that the Department of Human Services should have considered but did not consider and asked the following questions. Why that provider debt balance continued to grow since 2016, why the percent of the portion of debt it did not expect to recoup did not change since 2019, and why older balances, some dating as far back as 2006, had not been considered or written off. So as a result, accounts receivable is overstated in the state's financial statements. So our recommendation here, very similar to what you always hear, obviously improving internal controls here, right? And then also accurately reporting the accounts receivable balance in the state's financial statement. And then our last finding is really about the claims data in that Medicaid information system. So here the Department of Human Services was unable to provide adequate data to enable us to confirm the outstanding provider balances. So during our testing, we were not able to confirm balances for 20 of the 59 providers that we tested. Those variances ranged from $43 to approximately $152,000. And then 65% of the samples that we tested had inaccurate dates. So if we kind of go back to that 2006 date that I was talking about on the previous slide, it's hard to tell the accuracy of those dates. So why did this happen? So the claim data is only retained in MMIS for approximately 3 years. After that point in time, there's only summary level data that is retained. And so one of those things that is lost after the 3 years is the comments. And the comments are back to those adjustments that are made. They'll tell you why an adjustment was made, right? Was it an error? Was it a rate change? Was it because there was an audit done? What triggered that change? So the balances that so there's that, right? Those are no longer available, so we have concerns with that. But then additionally, the balances that we used for testing came from that pre-program report that I discussed on the previous slide. However, the Department of Human Services has not reviewed or verified that report for accuracy, and actually no one currently at the department understands how that report was generated. And the person who generated that report is no longer with the Department of Human Services. So here our recommendations are that they need to retain adequate documentation and that they really need to ensure the accuracy of the data in MMIS. That concludes my presentation, and we're open for any questions. Thank you.
Thank you, Ms. Lyson, for your presentation this morning and the information that you were able to share with us, and also for finding this in the first place. This isn't something, from my understanding, that the legislature directed you to do necessarily. It was just in your normal routine of the work you do that this came about. Could you describe that a little bit more on just how you were able to get to the point where we needed to have this?
Sure. Thank you, Mr. Chair and members. So in the course of our work during that financial statement audit that we conducted, so in the fall of 2023, what we do in the normal course of that work is we have interviews with agencies, and we really like to dig deep and do a gaining our understanding of the areas that we're looking at. So accounts receivable in financial statement work is a risky area, so we always like to gain an understanding. The Department of Human Services has a lot of money flowing through it. That's a really large line item in the state's financial statements. So we really like to take a look, even if that amount in that one particular area, right? We're working it all the way down to that fee-for-service and medical assistance. Even if it's not considered material for the purposes of the state's financial statements, we're really trying to gain an understanding. So we're talking with the program people, we're talking with finance people, we're talking with leadership, and we're trying to gain that understanding. And it's when we really talk to the program people and the finance people about how they're collecting on that outstanding debt, because we noticed the balance was rather large, and it's, 51.7 million, and why is that the case, and what are you doing, and how are you collecting on it? And no one could tell us how they were collecting on it. That obviously raises some red flags. As Auditor Randall mentioned, it's not material for our financial statement work. We didn't have the time to investigate further, but that's why we ended up starting the performance audit in 2024.
Okay, thank you for that. And I guess a point to make, as long as I'm understanding this right, is that this isn't so much of a fraud piece that you're looking at. It's the way that the state collects on bad debt, really, on that. The organizations that were identified here, there were a number of reasons that the department felt that they could not collect on them. Is that common? I see the footnotes on the ability to collect from providers who haven't gone or who have gone out of business, but the number of reasons that there may have been an overpayment in the past, do you have any sense of what those items were that would have caused the overpayment in the first place, and just kind of understanding what we paid for overtly there?
Sure. Thank you, Mr. Chair. As I said, unfortunately, because of that data in MMIS is not retained and those comments are no longer available, we simply cannot tell what those overpayments were a result of. Again, it could just be that there was a rate adjustment. It could be that an error was identified. There's numerous reasons why those overpayments occur. I don't think it's abnormal for that to happen, but we simply just have no idea if there is one area in particular that occurred more than others.
Ms. Randall.
Thank you, Mr. Chair and members. Just to add on to that a little bit, I would say that the overpayments and the adjustments are a routine part of handling the program, right? Somebody put in the wrong code and it triggered the wrong payment. The date was wrong, things like that. I think it's so routine that the department does have policies and procedures on how to handle these types of things and how to handle adjustments. So I think the existence of an adjustment in of itself is not a concern. We didn't see any reason, no indicators of fraud, and we weren't looking for that, but we also didn't see any of that. I think the concern then, of course, is, why do those overpayments remain on the books, right? And some of it the agency would have to write off, and that's also a normal part of business. If the owner dies or the owner goes bankrupt, what of course is concerning is when those extenuating circumstances aren't in place and those overpayments remain on the books. One reason for this that I was told about was, if ownership changes, and that happens, right? You've got a small business who's providing services, for medical assistance, and maybe they merge, or maybe somebody buys out that business. My understanding, and Ms. Lyson can certainly correct me, is that the data problems kind of manifest here. So business A buys business B, okay? Transfer of owner. And now business B is set up as wait, now I already got confused. The purchaser, right, gets created as a new provider. And the target, if you will, the original provider, had that balance. But because of the way the data are handled and because people aren't clear on their responsibilities within the department, that overpayment didn't get assigned to the purchaser. So now we have the business that no longer exists with an overpayment balance, the new business that may or may not even know that they had this credit with the department. They may or may not even know that they're supposed to be, paying back the department. And now they start doing active claims. And now the original debt is residing with this, entity that no longer has active claims. So one, that's the problem with the data. Two, it's a problem with who's responsible. Three, it gets back to our comments about the department should try to do some recovery, as simply as sending a letter. Because again, the new owner might not even know that they had assumed the prior debt, if everybody's following with my hands. And so some of it is simply like, hey, we've looked at our books. We see that we have an overpayment with you. We're gonna, charge your new claims against this balance until we're back to, zero. And so some of it we think is just informing those folks, and then of course monitoring it. I mean, the other problem, as Ms. Lyson said, is nothing. I won't say nothing. This issue hasn't clearly been addressed or looked after since 2015, maybe 2019. That now is a big administrative burden for the department, right? Because they haven't been dealing with this. And so now they're saying, well, we're gonna write off any balances under $1,000 because it's gonna take us so much effort to match things up. It's gonna cost us more than $1,000. But if internal controls were in place, if responsibilities had been clear and clearly assigned, and people were doing what we all expect them to do, this would be an annual process, right? Or a quarterly process. And then it's not a big administrative burden. And then it's not a problem that the data are only retained for 3 years because we clearly see, oh, business A bought business B, okay, we have to assign the debt. So a lot of this is kind of the bread and butter of internal controls and good oversight and good governance that if those things had been in place, I don't think we would be in this situation. All right, I really strayed. Sorry, thanks.
Yeah, and just thank you for that. One final question from me then, Ju, your last point there, that the department, at least in your interviews with them, feels like they could go back 6 years, and that was the statute of limitations from their interpretation. That's different from yours. But the data is only retained for 3 years. So really, they're only giving themselves the ability to go back 3 years before it's lost. Is that am I understanding that correctly?
Thank you, Mr. Chair. That's correct. The data is not retained. summary level data. There's data there that is still retained after the 3-year period of time, but the reasons why, right, the adjustments and why that stuff has occurred is no longer retained. I know the Department of Human Services is trying to pour through that data currently, and through the course of our audit was essentially learning alongside of us the data and really kind of uncovering the limitations or the kind of identification of how we can identify these balances. So I'm not sure the Department of Human Services knows at this time, and maybe that is the case, on whether or not they can clearly identify debt that is past, like the balance of the debt that is past that 3-year period of time. What we can't see is some of the comments and the reasons why it's hard to track it. It's really hard to follow it. The data in MMIS is vast. And when you're going back as far as, 2019, 2015, debt that may have gone back all the way to 2006, you're going to start to have some real problems because there is a lot of stuff happening. Again, if we go back to that one slide, we're talking about one little slice of, programming within the Department of Human Services using MMIS. I mean, MMIS is used for many things. So the data is vast and it's a lot. And I'm not sure whether or not they currently have the ability to look at that debt past 3 years and really accurately identify the balances. Now, again, that pre-program report that they're running, if they understood how that's being ran, if they were really checking it and verifying it for accuracy, I think more reliance could be placed on that pre-program report. It's our expectation is that you're always looking at that, right? You're making sure you understand why that information is being pulled. Is it being pulled for the accounts receivable purpose of financial statements? Is it being pulled to identify the outstanding debt that exists for a provider? Those are two very different things, right? We might still have debt that we want to recover, but we're not going to identify all of that on the financial statements. So I think if reliance could be placed on that pre-program report, then they can kind of move forward. But they don't have a strong understanding of that. They weren't able to tell us at all what numbers were being pulled and how it was being created.
Okay, thank you for that. We do have a few member questions. We'll start with Representative Gilman, then Jacob. Representative Gilman.
Thank you, Chair Schumacher. And thank you so much for just the overview of this report. I'm just fascinated by this topic. My question is it Ms. Lysine, right?
Ms.
And
Lyson, correct.
Oh, Lyson, okay, great, thank you. Or Ms. Randall, whichever one. Wondering about who specifically, at DHS leadership gave the approval to not collect the provider balance. Like I was just looking on page 9 of the report on that. Like, again, we're just trying to identify, who specifically did not do that, since this is a pretty massive number. Thanks.
Ms. Lyson?
Thank you, Mr. Chair and Representative Gilman. Unfortunately, we're not entirely sure who made up leadership. We were told that leadership made that decision, but we don't know who exactly sat in that meeting and made that actual decision. So unfortunately, we don't have that information.
Representative Gilman.
Thank you so much. Okay, so that is a question mark. Okay, my second thing I'm curious about, again, when we're talking about waste, fraud, or abuse, and how does this happen? And I heard you mention just, there was a lot of people, like wires being crossed. I've been in the legislature now, this is coming into my second term, but these are such ginormous numbers and such big accounts and big things like that. When we talk about errors being made in your data, were you able to determine, yearly in your report, was this bucket of dollars, was this a clerical error, or was this truly something that, we've read about in the news and heard about in the news? Like, do you separate that, like, just so we could see those numbers? Mm-hmm. Are they clerical, and then do they go back and change those things and they're rectified? Or are you saying even when the numbers are maybe smaller, those things aren't addressed if their error is clerical errors?
Ms. Lyson?
Mr. Chair, Representative Gilman, that's an excellent question. Unfortunately, our audit really focused on the recovery of the debt. And because we didn't have a real strong understanding of the data at the end, because we saw such discrepancies, we just simply didn't have the time to look into things further. I will say that I'm sure clerical errors occur, and I'm sure other errors occur, right? I'm sure there's numerous types of errors. And once again, because we don't have that information after 3 years, we don't know why those corrections were made, why those adjustments happened within the system. And even the stuff that happened within the last 3 years, again, it was really out of our scope, but it's a great question. Unfortunately, we didn't cover it.
Okay.
Representative Gilman.
Just to put on the record, I'm very excited that we are going to take, that we had time for this, and just that we can just take more time in all of our committees to just have more oversight and have great communication. And I'll be excited for when DHS comes to share their experiences as well this past year. So it'll be good. Thanks.
Thank you, Representative Gilman. Representative Jacob.
Well, thank you, Chair Schumacher, and thank you for your work on this, bringing this to light. A couple of questions. So it almost seems as though, in this case, that administration at DHS is being, I'll say, somewhat defiant. Would you say, since you first brought this to light until now, are you getting what I'd phrase as full cooperation, and are they doing everything they can to resolve the issue?
Ms. Lyson.
Thank you, Mr. Chair and Representative Jacob. I think we have the full support of the Department of Human Services to understand the concern and the extent of this debt and how concerning that is to taxpayers and what that looks like to the public. So I think they're taking it very serious. Where I think that we have concerns is on the recovery of that debt that is under $1,000 and the debt that is over 6 years old. Again, as Auditor Randall stated, they essentially put themselves in this situation. Had they been proactive and really responding immediately, we wouldn't have debt, that may have gone as far back as 2006. So at the very least, I don't think it's a significant administrative burden to do a nice little mail merge of all the providers that have outstanding debt, and at the very least, let them know that there is outstanding debt and give them the choice to provide payment on that debt, right? I don't think that's asking too much. Maybe if we're talking about real active recovery after the notification letter, that's a different conversation. But what we're seeing at the very least, let's just notify these providers. So I think, we had the full cooperation. They were very active in the audit, took it very serious. Like I said, they worked alongside of us to really try to understand the data, understanding the concerns that we were raising. But it's those categories that they're not recovering on that we just have some concerns with.
Representative Jacob.
Yeah, one follow-up then. So if they're not really fully cooperative at this point in recovering all the dollars that they could be recovering, have they made any other efforts to give restitution to the taxpayer? Is there any other place in their budget that they're saying, well, this is too difficult to resolve, but the taxpayer needs to be made whole? Have they offered any other solutions?
Ms. Randall.
Thank you, Mr. Chair and Representative Jacob. We're not privy to that, right? That's part of their budget proposal, and I think we'll let them answer to that question. I did want to point out one other area where we think that there's an opportunity for the legislature to work with the department to clarify perhaps their ability to pursue recovery for longer than 6 years. I would say that is probably the one area where OLA and DHS disagreed the most in terms of their ability to recover. So we have the balances under $1,000, and then we have the balances that are over 6 years old. In their response, which is at the back of the report, they clearly state that they don't believe they have legal authority to pursue balances that are over 6 years old. And as Ms. Lyson said, OLA disagrees and comes to a different conclusion. And we had several conversations with their general counsel and had conversations regarding the different case law that kind of touches on this issue. At the end of the day, the case law is not clear about this specific type of overpayment, this specific type of debt, and the Department of Human Services, in particular, their authority, whether or not to collect. Our take is, go ahead and try it, right? And their take is, we don't think we have the authority. And so our response to them in those conversations was, if you don't think you have the authority, then why aren't you going to the legislature to clarify and get that authority? And so we have encouraged them to do that this session. And so I certainly hope they're coming forward with those proposals, but I would also encourage any of you to also clarify for them that they do have the authority to pursue those older balances. So I know I didn't answer your question about restitution to the taxpayer. I think that's something for the department to answer about how they want to address this going forward. But I would just encourage you all to take a look at the law if they think they don't have the authority. And if you want them to be able to pursue it longer than 6 years, then let's really clarify that. And if you're okay with where it is, then obviously don't. That's your prerogative. But I just wanted to point out that opportunity.
Representative Jacob.
Yeah, one last question. When they talk about some of the funds that they're deciding that they don't want to recover, they state that it's more expensive to recover the funds than what they would actually get. And I've been in that same boat back in the county board level where it was more expensive to issue refund checks to the taxpayer than what the checks were worth. But it's an issue of right and wrong and what sets a precedence into the future. And what's really how do they defend, what's their position on, well, it would cost more than it's worth, so we're just not gonna do it? I mean, that still doesn't answer what's right and what's wrong and what's fair.
Ms. Randall.
Thank you, Mr. Chair, and Representative Jacob. So my first response is, certainly if the department comes, or when the department comes before the committee, that's a great question for the agency. We did, of course, have numerous conversations with them about that. So as Ms. Lyson and I have both said, if things had been working as they should have been all along, right, it wouldn't be a very big administrative burden to handle. And they would agree with that. What they have communicated to us is, given where we are now, right, taking where we are now, and because of the state of the data, and because of provider or ownership changes and all of that, the work to tie these outstanding balances to a specific provider and trace it all through the years and all through MMIS is a lot of work. And so what the agency has said is, given where we are today, is that the best use of our resources? Is it worth it to do, a week's worth of work, I don't know how long, I'm making that up, to recover a $500 overpayment to one provider? And they have come to the conclusion that it's not. I don't know that it's taking into consideration the message it sends and the right and the wrong and the precedent. I think they're looking at it, in the present day, the best use of our resources. So that's what I feel has been communicated to us. I don't want to speak for them. I already have, probably more than I should, but I do think it's a good question to ask them, because I think those questions about precedent setting and kind of doing the right thing, I think those are good, important questions that you should pose to them.
Thank you.
Representative Jacob.
Thank you. Good.
Okay, any further questions from members? Representative Gander.
Thank you, Mr. Chair, members. First of all, thanks for the objectivity that you bring to this process. the clarity that you bring. I mean, if we don't have that kind of clarity, we can't make good policy whatsoever. So I really thank you for that. Couple questions, and the first is, within DHS, is there any evidence that they question your findings? I mean, do they seriously question the dollar amounts and categories that you've come up with?
Ms. Lysom?
Mr. Chair, Representative Gander, I don't think they're questioning what we've identified. I think they're in full support of what we've identified and understand that these balances exist, that they've existed for a long time. I think that you can see it with what they've reported to Minnesota Management and Budget year after year, and that it's increased dramatically from, 2016-19 to today. So I don't think they're disagreeing and disputing any of the amounts that we're coming to.
Representative Gander?
Yeah, thank you. I think at the end, you drew a nice, you connected some dots very well. There's quite a connection between the quality of information that they have stored regarding these amounts, including the comments, including the specific providers, the dollar amounts, the dates. If you don't have that data, it will become increasingly difficult, or if the data is so obscure that you have to comb through and glean it from like random sources, it's not categorized and connected to a certain provider, then the complexity of collection goes up that much more. So as you talk about going forward, internal controls, maintaining that data and collectability of debt, there's quite a parallel there. So when we look at that, I mean, this is going to be for DHS, but I want to make sure to register that for the group that these things going forward make all the difference. And then one final thing, as a provider who does submit claims to medical assistance, to me, this one more category that we haven't talked about. If I have 10-year-old overpayment debt that I owe to DHS, but you never told me about it, I would argue that's wrong. But if you told me about it 10 years ago, 9 years ago, 8, and I still haven't paid it, that to me is a different category. So if that's in those comments also, you'd have to show they were properly notified of that outstanding debt 7, 8, 9, 10 years ago, whatever the number is, then it becomes more collectible today. Thank you.
Thank you, Representative Gander. Anything in response to that? Ms. Lyson?
Yeah, Mr. Chair and Representative Gander, I think that is correct, right? I think understanding the data is everything here going forward. Understanding how to look at it, understanding how it's being pulled into different reports, and really making sure that you have retained the information necessary to recover on these outstanding debt. If you're an active provider, the system should be working. Now, we didn't get to test this, but it should be working efficiently in the way that it's going to offset any of those future claims, right? It's really when they become inactive or they have a change of ownership that this becomes imperative that they understand the data and they retain it long enough. Now, the Department of Human Services has made the decision, and I'll refer you to their response in the back of the report, but they will retain the data for longer. I think they understand that they simply can't have it only for 3 years. That's not enough time. Now, don't want to also say that there's no data that exists after 3 years. There is data. It's just, again, that to be able to comb through it and to be able to understand it is the difficulty that we find. And again, the longer you go and the more transactions that are occurring in that system and you're trying to piece it all together, when that adjustment occurred, how did it occur, that's where it becomes really more difficult. So I think they understand the value and the importance of retaining that data longer.
Representative Gander?
If I could, just one final thing on change of ownership. There would be two ways to change ownership for, let's say, a medical facility. One is I purchased the assets and created a brand new entity that this one ended, this one started. I think you'd have to go to the original provider in that case. But in some cases, the purchase is shares of, and the clinic goes forward. So I'm sure you guys have parsed it down to that. But there will be times when the end of an entity means the end of, you cannot collect from the new entity because of a legal change of operations. Thank you.
Thank you. Further questions from members? Okay. Thank you again for your time this morning. I just have a couple more things as we were having the discussion that kind of came to mind. And talking about the legislature's role in all of this, on the oversight piece, on finding this in the first place, and those sorts of things. We've discussed this morning already about the current recovery process and maybe the legislature's involvement in that piece of it. The following of the policy and the fact that there were fingers pointing in two different areas that should have been doing the collection, that's something that the legislature should have some form of oversight over, or there's got to be, the buck has to stop somewhere with that. The thing that I would like to ask kind of in the closing is, how could we have prevented this from being an issue in the first place? From a legislative standpoint, we don't look through the books on all of this. We don't get into the daily management of these organizations, but we do have the oversight responsibility for all of that. We have to be responsible to the 44,000 people in our districts that are paying the taxes, that are going to pay for necessary services, but also are not being collected when they went to pay for services that didn't exist. And so, just kind of a broader scope, is this something that we should be relying on the legislative auditor to be doing more? I know that was a discussion you all had yesterday on what your role should be. Is that something that we should be looking to you more for that? Is there more that we should be doing, that we could be doing? I guess, I don't know how much you want to push an agenda on some of that, but are there ideas or thoughts on what we could be doing from our role to get ahead of this a little bit more? Because to me, it seems like there's just some human error, just some large bureaucratic error in a lot of this, and it's good to hear that the department has been making an effort to correct this moving forward, but how could we have gotten ahead of this in kind of your view of things? Ms. Randall.
Thank you, Mr. Chair and members, and thank you for the question. I think it's a really thoughtful question. I don't have an easy answer, of course. Nothing's easy here in government. So a couple of thoughts. In response to how could the legislature have prevented this? I don't know that you could have. There's a separation of powers here, right? And the legislature relies on the executive branch to execute and implement the laws, and you expect them to be followed and handled properly. And I think that's appropriate. I don't think it's the legislature's role to micromanage, into agency policies and agency procedures. I think it wouldn't be right in terms of separation of powers, and also you don't have the time for that, right? So I think some of it you have to rely on them to do their job. I also think, though, that the legislature has an important oversight role. Hearings like this are important. Hearings where you show agencies that these are the things you care about and that you're going to ask questions about matters. Asking these questions when agencies come before you to ask for new programs or different, authority or different more money, less money, whatever, right? I mean, you have unique opportunities when they are before you to ask serious questions and informed questions. And not to say that you don't, but I think that that's really the opportunity there, and to say what matters to you and what you're expecting from them. We, of course, are part of that. The Office of the Legislative Auditor, we are kind of your year-round oversight and accountability office. And so part of that responsibility for you is for us to be doing our job, right? And to be bringing these things forward. Again, something like this, I wouldn't expect the legislature to be able to proactively do something about, but when we find it, okay, now you have this information, right? And so now I think there's a responsibility that you all have to follow up with the agency, privately, publicly, however you choose to do it. There are other situations separate from this report where when we go in and do an audit or do a program evaluation or a special review, where we do find that the legislature contributed to some of the problems, to be frank. And those tend to be places where you establish a program without clear goals or without measurable goals. And we do see a lot of that, especially related to grants and grants management, where we'll go out and look to see if a a grant program has been executed properly, and we'll go and try to measure it, and we'll say, well, to the agency, show us how you're meeting the goals, and they'll pull out some goals, and we'll be like, well, those aren't, real goals, right? And then we'll go to the law, and we'll be like, oh, well, now we understand, because the legislature didn't set clear goals or measurable goals or expectations that the agency set clear measurable goals. And so then when we all go and want to hold somebody accountable for a program that maybe wasn't as successful as we hoped, well, nobody was responsible, right? Because we didn't set that up in the first place. So I think that's something for the legislature to maybe take to heart, and that's, again, not proactive on this specific issue, but in general. I would also say just grants in general are always a risky area. OLA has spent a lot of time looking at grants, and one thing we especially have found for years and years and years, I know we said this back in 2007 in a report, and we have said it since, is that grants that are legislatively named, where the legislature has put into law a specific grantee will receive this much money, those grants especially are subject to less oversight, because an agency that has responsibility for the oversight looks at that and says, well, it's in the law that program, that grantee XYZ is going to get this money, and so what authority do I have to hold them responsible, because they're getting it no matter what. So to the extent the legislature, and we have recommended this in the past, shy away from naming specific grantees, I think that helps oversight. Now, that's, again, very different from this program, I understand, but I thought, since you asked me the question, I take the opportunity to encourage you all to think about those things as you move forward. Thanks.
Yeah, and thank you for that. I think especially in the beginning of this legislative session and just setting up our role and expectations for the year, having that conversation, having a broader idea of what we should be looking for. It reminds me kind of like in business, you write up the terms of the partnership agreements before things go bad. So when things do go bad, you have something to go back to. And a lot of times in legislation, it's the most optimistic that when we're passing bills or grants, especially, that everything is going to be fine and it works out great, but we need to be prepared for those times when it's not, and be willing to have those conversations beforehand, and not to avoid the extra problems that you end up seeing, that we end up finding in a report and then asking you what we could have done better in the future. So hopefully I don't have to ask that again in a few years, but likely I will with that. But are there any other questions? Representative Gilman.
Thank you, Chair. I just have one follow-up question. Thank you. Curious if your processes in the last 4 years have changed on how you're collecting your data and your information to compile your report. And if you're using like new software, or do you have to come back to the legislature to ask for things like that with AI and all these different tools that are available and accessible, and they can help streamline things and collections? I just am wondering if your processes have changed, or have you kind of had the same process in the last, let's just say, 4 years?
Ms. Randall.
Thank you, Mr. Chair. Representative Gilman, thanks for the question. We have not come back to the legislature to ask for specific software or technology or things like that. So just to answer that question, we have our own budget and we would do those things within our own budget. I guess if we had some really extraordinarily expensive thing that we absolutely had to have, we would come, but that hasn't been the case. I would say our process has changed, as everybody's has. More grant files, case files, things like that are electronic. Right? I mean, there was a time when I would go out to a field office and literally sit with a stack of files and make my way through them, right? We don't do that anymore. I guess occasionally we do. There are still some agencies that have paper files, but most things have gone electronic, so we will get access to an agency's SharePoint system or to their e-grant system or whatever, and so we can do it electronically. We continue to refine our tools and, our data analytics and all of that. With respect to AI in particular, we are moving slowly and cautiously with it. I sit in on the enterprise-wide technical advisory Committee, I think it's TAC, I don't actually know what it stands for, where they're discussing the use of AI across the enterprise and policies, and we have our own internal OLA committee looking at that as well. I do think eventually there will be opportunities to help us streamline our processes. The biggest concern for me right now with respect to AI is the security of the data. We have access to data of all classification at OLA. We're under the Government Data Practices Act, but we have access to all data that agencies hold, even not public, very sensitive data. And of course, we have a responsibility to protect it, and we don't mess around with that, right? We take that very seriously. And so until I am convinced that we can protect that data and use AI, we're going to be limited in how we can use AI, because we would only be using it on public information. So we're talking about it. I'm talking with our national organization and our kind of, peer offices across the country on how they're using it. Honestly, there's the question of how we use it internally, and then there's the question of how to audit when agencies are using it, right? And that's a whole other quagmire for us, right? Because at the end of the day, we want to see that a person is responsible for making decisions. And so, anyways, lots of conversations. We're definitely thinking about it. We're always looking for ways to improve our processes. We have some fabulous staff who do some really excellent data analytics, but we still have a ways to go with respect to AI.
Representative Gilman.
Thank you for that just extensive answer. It's very great. It's very helpful. So just to follow up really quick, I appreciate also that we have some recommendations along with just the report, just some recommendations. Have you, my question is, Chair, is if the policies, procedures, or processes, if there's like very specific ones that you believe overall departments should be following, have you found in your collections of just across the board, just like a certain policy or procedure that has not been done? You identified several of them, just, I'm a business owner, and I can't imagine seeing the accounts receivable that way year after year and it growing. Like, I can't imagine seeing the different things that could be happening. So I believe, again, that kind of comes back to the legislature and our responsibility, oversight and accountability for departments to, and I guess if it's just basic economics that we have to go back to, but if there's something specific that is like glaring, do you believe that you've, accurately like told us that in your recommendations? Or is there something specific in a working group or something that we could, observe or just hear more specific details on recommendations of policies, procedures, things like that?
Ms. Lyson.
Thank you, Mr. Chair and Representative Gilman. I think, what you'll see here in this audit is the foundation was actually there, right? You have to follow GAP. The state has policies on how to administer, how to identify balances and report those to Minnesota Management and Budget. So everything was there for the financial reporting purposes, right? The foundation exists. And then when it comes to, outside of the financial statement, and then it comes to recovering outstanding debt, again, that existed. That existed in their manual and their policies and procedures. The piece that's missing, it's the internal controls. It's to ensure the implementation of these policies and procedures is happening. And that is what we see over and over again. It's not that the foundation's not there, it is there. It's that there's not that supervisory oversight. In this case, for instance, when they're reporting that accounts receivable, they're identifying it from that pre-program report. They're saying, okay, this is our balance, it's 51.7 million. Then it's going up to the financial operations division, right, that finance division. They're signing off on it. They're looking at discrepancies. I think their variance is maybe anything that's changed from 5% or 10% year over year. And they might ask some questions, but they're not really looking at the data, and then they're signing off on it. Then it goes to Minnesota Management and Budget, where there lies another opportunity for them to say, why is this accounts receivable going up over and over again, right? So again, the foundation is there, it exists. It's really saying, what is your role? What is the processes to ensure the accuracy of this information for financial statement purposes and then also the recovery, right? So if for financial statement purposes, this is an optimal time to see if the debt is increasing year after year, right? It's a prime time. It's going through the program people. It's going through the finance division people. There's supervisors within here that are looking at this. It's going to Minnesota Management and Budget. There's a lot of people looking at this, but are they looking at it, right? Are they really understanding what they're seeing? It shouldn't take the legislative auditor to come in and say, why are we seeing it increase year after year? Somebody should have been answering that question, which then can get to the recovery of that debt as well. So I'm going to say it over and over again. You saw it in the recommendations. I think each of my 4 findings talked about improving internal controls. That is what's lacking in state government that we see oftentimes. And I'm not going to say it's everywhere. It's not in every agency, in every division. But when we have our findings, those findings exist and they happen because of a lack of internal controls.
Representative Gilman? Anything further from members? All right, I'm not seeing anything. Thank you again for, first, the work you do here. Thank you for being the type of people who are excited, I'm assuming, to see a stack of papers to be able to comb through and get the data that you need, because it's important to the rest of us to be able to do our jobs better, to be able to be servants of the people better. And so really appreciate how serious you take your role in all of this, and the work you do to keep this very professional and just to do a good job. And so appreciate that, appreciate your time this morning, appreciate you allowing us to expand beyond just this report to talk about your role in the legislature as a whole. And with that, members, we'll see you tomorrow morning at 8:15. We are adjourned.